Hospitals in Arizona welcomed the return of elective surgeries this month. Services had been paused to make room for a possible influx of COVID-19 patients. That led to financial setbacks for some facilities, including Tucson Medical Center, which estimates it has lost more than $16 million these last 2 months. We learn more from Chief Operating Officer Mimi Coomler. Tucson Medical Center has about 4,500 employees. Have you had to reduce staff or place any on a temporary leave as a result of COVID-19?
Yes, who would have thought that the results of a pandemic would result in laying off or furloughing of healthcare workers? But based on some of the changes that happened in terms of our nation and our state's response with reducing elective surgeries, reducing elective diagnostic tests, the numbers of patients that walk our halls or seek treatment at TMC have been reduced dramatically. In surgery, we have reduced our surgical volume by 60%. Diagnostic mammography we put on hold entirely. And so many of our healthcare workers, we've tried to preserve their benefits and their positions, but we've reduced their hours, in some cases up to 60%, and in most cases, at a minimally 30%.
When the governor announced that elective surgeries and other treatments or tests could resume, I can imagine that you can't just flip a switch and start at work back to normal. So, how did TMC prepare for that announcement?
We worked in partnership with a number of different surgeons, from neurosurgery to general surgery to women's surgeons. And we came together to talk through what an algorithm looked like. How do we determine which patients should proceed with surgeries, which patients we should put on hold? Medicare published some guidance around how to sort of stage and prioritize surgery. We relied heavily on that document. And some of that was a day by day, hour by hour assessment and reassessment. We have been lucky to have never had not enough PPE, a shortage of PPE. So that was not a consideration for us. We also never had a shortage of ventilators or ICU beds.
Mimi, in addition to being one of the minds that helps run Tucson Medical Center, your background is in nursing. What is your prognosis for how Tucson Medical Center moves forward?
My prognosis is that we have been here for 75 years serving this community, and we will be here for another 75 years and beyond. We will weather this storm. We will weather it as we have in partnership with our community. As a nurse, I know that it will take some time for us to recover. You're starting to read some of the stories about the trauma that healthcare workers face. There's unquestionably been a lot of anxiety on those who are working on the front lines, trying to determine how to keep themselves safe, how to keep their families safe. And many of our physician partners are running their own businesses and their own practices and trying to figure out how to keep their own companies solvent and safe.
You raise an interesting point because, as a business person and a healthcare worker, you've had to reconcile with some tough decisions during all this. What is your message to the public?
My message to the public is to seek healthcare services if you need it. I think we have too many patients at home with a lot of questions, and we're here. We're ready to provide answers if you need them. The emergency department is here. The thing that concerns me or keeps me up at night is the dramatic reductions in heart attacks and strokes that are presenting to the emergency department. And I worry that we have people who say, I don't want to get COVID, so I'm not going to go to the hospital, but that decision would result in something worse than COVID.
Okay, Mimi Coomler from Tucson Medical Center, thank you for your time.
Thank you very much. I appreciate it.